So we're going to go right into our discussion today. We're speaking about the 5 things, my top 5 things that you need to know if you are diabetic or pre-diabetic. So the 5 top things you should know if you are diabetic or pre-diabetic. So as a family medicine physician, we see diabetes constantly. It's what we say is our bread and butter. And a lot of times when patients come to see me, some of them have had that diagnosis years ago, or they have family members who have had that diagnosis years ago and they're concerned. And then there are some individuals who just got diagnosed or they're pre-diabetic. So I want to talk to you today and let you know about some of the things that you should know, some of the things that you should avoid, and some of the things to keep in mind. All right, so let's go ahead and start speaking about one of the first thing of diabetes. If you have a family member, a primary degree relative is what we call it in medicine. If you have a family member, parent, sibling, or children, who has diabetes, this does increase your risk of actually having diabetes as well too. So in other words, if your mother, if your father, if your brother or sister has diabetes, or even one of your children, it increases your risk of having diabetes as well too. So that's number 1. And I think that that's important to know, because it will let you know as you go, as you get older, as you're seeing as you are just seeing about your health as well too, you'll have an idea of what could be on the horizon and what to stay away from. A lot of times we say diabetes is like a train that's traveling. So if the diabetes stop is in Florida and it's traveling from California, this is what happens if you have a primary degree relative, parent, sibling, children who have diabetes. That train already is starting to move towards that track. So what do we want to do to keep you away from that? That goes to my number 2 reason. So the number 1 is, again, you are at an increased risk. Again, if you have a first degree relative, parent, sibling, or children with diabetes. Number 2, how do we keep pre-diabetes from becoming diabetes? So let's stop for a moment and let us define what the 2 are. We hear diabetes, this term, a lot, and we need to know exactly what it is. Essentially what it is that your body is not producing insulin, or your body is resistant to insulin. This is causing increased glucose levels to be hanging around in your body, and then that is what subsequently causes diabetes. There's a number that's measured every 3 months in a diabetic patient that's called the A1C number. A1C number. If you could put in the comment line A1C, the letter A, the number 1, the letter C, that's the number that's very important for us. So your pre-diabetic patient, any number that's above 5.6 to 6.5, this is considered pre-diabetes. And when that number gets to 6.5 or above, that is now gone to become diabetes. And one of the ways this happens, and I find in my patient population, is that when they tend to skip meals. Don't skip meals. It's a big one. Do not skip meals. We want you to have small, frequent meals. And a lot of patients, they just become afraid. They hear diabetes. They think that, well, I'm eating too much, or I'm having too much sugar. So they end up just panicking and not eating anything at all. And that's one of the worst things that could happen, because that actually causes more resistance, causes more insulin resistance. And we want your body to be able to be responding to the insulin, and we want your pancreas to produce insulin. So again, one of the things you want to avoid, and we don't want to have that prediabetes to become diabetes, the one thing to avoid is making sure you are not skipping meals. So number 1, increased risk if you have a relative, primary degree relatives. Number 2, we want to make sure we keep pre-diabetes from becoming diabetes by eating the small, frequent meals. And that's also part of our number 3. So we've combined the number 2 and 3. The small, frequent meals is very important, and not just for your diabetes patients, but even your pre-diabetics. And I would say truly for all of us, a lot of us, and I would say the individuals who are grinders, who are very focused, who have great work ethic, they eat first thing in the morning, maybe, but they really want to get the task done. They want to get the job done that they're doing, so they tend to skip meals. They just push right through. And again, that's skipping meals. That's causing more insulin resistance. We don't want that. So avoid that by having small, frequent meals. So those are our 3 so far. We have 2 more. So we have number 1, again, primary degree relatives, first degree relatives increase your risk for diabetes. Number 2, you want small, frequent meals, small, frequent meals. And then number 3, individuals who have prediabetes, they're definitely at that risk for it to become diabetes. And these are some of the things that we're speaking about to stay away from them. So remember, we were speaking about what's actually going on with diabetes. You have this increased amount of sugar that's kind of hanging around, or glucose that's hanging around in your bloodstream. And one of the ways we could get rid of that increased glucose hanging around in your bloodstream is get moving, exercise, do the things that you enjoy doing. I really don't like to say exercise because that sounds like work, but I do want you to do the things that you enjoy doing. So whatever that may be, if that's dancing, then 3 times a week, play the music in your house and have dance parties. You're moving, that's exercising, that's getting things moving. And why is that important, particularly as it pertains to a diabetic or even a pre-diabetic? When you are exercising, when you are moving, when you're doing the physical activities you enjoy doing, that glucose that's in your bloodstream gets shunted to your muscle groups, and it removes it from the bloodstream to the muscle groups, your larger muscles, so your muscles will have that energy to keep up with that activity. So that's what we need to do, get moving. So if you can put in the comment line, get moving, that's what we want to do. You want to get moving, and that's going to, again, help prediabetes from becoming diabetes, and it's going to help us to be able also to control the diabetes. So that's 4 so far. We have the primary first degree relatives. We have the small frequent meals that are important. We want you to start moving, move and do the things you enjoy doing. And then of course we said these are all the things that will help prediabetes from becoming diabetes, and then also help just control altogether individuals who are diabetic as well. And last but not least, and this is where that post really came in today, the what I call the forbidden fruit. The forbidden fruit of the diabetic patient is the mango. Whether it's a mango that you're eating or it's mango juice, either one of these, this is the forbidden fruit of the diabetic. I really do not know why, but what I have seen in practice and in patients are patients who have completely controlled diabetes. So the A1C is below 6.5, they're doing well, they're doing great, and then mango season happens. And if you're here in South Florida, everywhere you turn, there's a mango tree. And if you're like me, you love mangoes. But this is very important for individuals who are diabetic to stay away from the forbidden fruits, which is mangoes. For some reason, it increases that A1C very, very quickly. So a patient that I had in practice, she was completely controlled. In May when I saw her, didn't have to see her again. I brought her in 4 months later, right in the middle of mango season. She didn't do anything. She was still keeping up. She didn't do any real changes, so she was still keeping up with her medications. She was still having her physical activity. But the one thing that actually her granddaughter was saying more is that grandma's eating mangoes, Dr. Elise, the big ones. So the mangoes. Now, I will never tell you stop eating anything, and I will never tell you to do something that I just feel like I can't do. If someone were to tell me stop me eating mangoes altogether, I just couldn't do it. But if you tell me, Dr. Elisa, just have 1 or 2 for that entire week, that's what you want to do. So just moderation, moderation, moderation. You really shouldn't be having a lot of mangoes. If you're diabetic, if you're pre-diabetic, avoid this fruit. Just have one, maybe once a week, so that you can still enjoy its fresh, tangy, wonderful taste, but still have control of your diabetes. And what I like to say is that we want, and I always want my patients to have control of the diabetes and not the diabetes to control them. So that's really sums up my top 5 things are very important for all patients who are diabetic, who are pre-diabetic. Number 1, you need to know if you have a first-degree relative who is diabetic, you are at increased risk. So what do you have to do? Number 2, you have to get moving. You have to do physical activity. You have to start keeping this in mind. Number 3, you have to have small, frequent meals. Keep your small, frequent meals up, because this is going to help keep away from insulin resistance. So the small, frequent meals are very important. Number 4, just avoiding the prediabetes to becoming the diabetes. It goes back to one of the numbers we said before, and make sure you're not skipping meals, having the small, frequent meals. And then finally, our forbidden fruit. Stay away from it. So if you have one once a week, that's fine for all my diabetic patients out there. But anything more than that, that A1C is going to shoot up very, very quickly. And all of you already know that once that number goes up, it is very difficult for it to come back down.